I have to find a way to take care of both of us. That's a big challenge for me. Really, really a big challenge for me.
As it is in July 2020 last year, unfortunately I'm at an accident. I don't know what the cause.
I was told that someone pushed him on the pavement and he fell. Maybe probably landed on his head first. Yeah, and then that's all I know because I wasn't at the scene. He had stroke during his coma, in his coma stage basically. Yeah, like after the surgery.
Motor skills, he cannot, memory skills, forget, looseness, verbal communication, thought process, verbal speech, everything. Maybe I'm confidence level. As at this point, I lost my job.
It's tough every day because every day is like a new thing, and it's usually unexpected event. For example, it depends on his mood every day. Sometimes he will get frustrated and he will lash out or something like that. What's changed is I have to be with him 24/7, like most of the time, and at the same time I have to manage his business. It's a struggle. Now I have to find a way to take care of both of us. That's a big challenge for me. Really, really a big challenge for me.
It's overwhelming. It's frustrated. I will move forward negative and focused and move forward. And next step, now I do eventually rehab. Cheras Hospital. For now, I have to improve. Chip by chip. I'm back with that. I'm back. So as long as I move forward, I can't go wrong. I'm fortunate because I'm independent. Actually, I can food, I can walk. My stick no longer. It's every obstacle. So I'm grateful. I'm a fighter.
The situation with TBI people, the traumatic brain injury people, sometimes caretaker tends to blame themselves. But what I learned from the whole thing is you have to accept the process and just remember that every emotion is like a roller coaster, and you just to accept that this is a part of the process. Cannot blame people because sometimes you tend to get sometimes you'll be happy looking at his progress, and another minute you will get frustrated with yourself, or you will get angry with the whole situation. Just remember that it's just a process. You just need to go through it. I'm not sure whether to say just to enjoy the process, but just try to enjoy the process, because just believe and trust that he will get better. He will be where we want him to be. So just need to be patient. You need a lot of patience and get the support.
A stroke is a condition whereby there is a total disruption or interruption of blood flow to the brain cells. So what happens to the brain cells is that the cells are deprived of oxygen, glucose and nutrients, thereby causing brain cell death. And this causes damage to the brain cells and results in what you see as strokes. How common is stroke? According to the World Stroke Organization, 1 out of 4 individuals worldwide may experience at least 1 stroke in their lifetime. And this ratio is very staggering. We need to know the risk factors and what are the risk factors related to stroke. The most common would be non-communicable diseases like hypertension, hyperlipidemia, diabetes, and also behavioral lifestyle, including smoking and inactivity, plus obesity. When someone has a stroke, there are many impairments that may be experienced, and this ranges from very mild impairments to very severe impairments as well.
They might have some difficulties in cognitive component. For example, mereka mungkin akan ada masalah penumpuan dari segi memory, dari segi planning dan juga understanding. Mereka mungkin mengalami kekeliruan. Kadang-kadang mungkin mereka tidak tahu kanan dan kiri. Hal ini mungkin boleh menyebabkan mereka tidak tahu untuk menguruskan diri, seperti memakai baju, pergi ke tandas.
I can't actually kind of like pinpoint on one area because it can actually affect all, including the executive function as well. But one thing that usually we can find very clear among all the patients is the processing speed. That one we can see very clearly, actually kind of like jumping down from their previous pre-morbid. So you can see that they are actually rather slow in a lot of area, including the ability to learn.
Due to the nature of the signs and symptoms being a multitude in nature, a very strong and cohesive multidisciplinary approach or interdisciplinary approach is necessary. So what stroke rehabilitation comprises of is multi-interventions which focuses on the patient goals and also personal needs, which means involving the caregiver opinions as well in determining the whole program related to stroke rehabilitation. To ensure a successful stroke rehabilitation program, the stroke rehabilitation team is the key factor. And this will comprise of individuals of different expertise and different knowledge and skills which work together to assist the patient towards their goals. The team may comprise of nursing staff, therapists, occupational therapists, physiotherapists, speech therapists, physicians and medical officers, medical social worker, psychologists, dietitian, pharmacists, audiologists, orthotists, and so many others, depending on the issues and the limitations in impairments faced by the stroke patients.
First kita akan assess dululah. Okay, when kita dah assess, and then baru kita tahu dia punya any deficits, contohnya physical deficits. So daripada deficits dia tu yang kita akan tackle untuk kita plan treatment kita. kita sebagai terapis memainkan peranan macam mana kita nak dividekan dia punya task tu supaya dia lebih dapat cepat tangkap. Okey, kalau macam transfer kita buat dia daripada, contohnya daripada satu step apa dia punya safety, contohnya nak lock wheelchair, dan then kita train dia macam mana nak stand up ataupun macam mana nak removekan dia punya armrest, dan then baru kita train dia macam mana nak transfer completely into to the wheelchair.
OT akan melatih pesakit untuk mereka berdikari dalam kehidupan seharian mereka supaya mereka boleh kembali bekerja atau berfungsi di dalam komuniti. Dalam proses rehabilitation, OT menggunakan dua pendekatan dalam rawatan pemulihan kepada pesakit yang mengalami masalah kognitif, iaitu cognitive stimulation dan juga cognitive training. Antara aktiviti pemulihan yang dilakukan oleh OT adalah seperti aktiviti untuk menguruskan diri. Sebagai contoh, apabila mereka mendapat stroke, mereka mungkin hilang keupayaan ataupun kemahiran untuk menguruskan diri. Jadi di situ OT sangat berperanan untuk membantu mereka berdikari dalam menguruskan aktiviti seharian mereka.
For clinical psychologists, basically the main major bulk of job is actually on the mental health and behavior. We are also doing the neuropsychological assessment. So because with understanding from the psychological point of view and understanding from the neuropsychological point of view, then we can actually make up a much more clearer picture about what is going on with the patient lah. Because of the patient's brain capacity at this moment, we can't actually just look at the mental health itself, because sometimes the behavior can be due to the dysfunction of the cognitive. So therefore, we will have to do on that part as well. So in order to understand.
First dia punya emotions, and then the second one is expectations. Kalau emotions tu, how we deal dengan dia punya emotions yang kadang-kadang dia sangat sedih and then marah, tu yang kita kena tackle. Tapi kita as therapist tu kena cuba untuk pujuk dia, untuk explain dekat dia kenapa everything ni happen, and then macam mana kita nak tackle, macam mana kita nak bagi dia semangat supaya dia boleh completekan each and every task tu dengan baik. And then the second one to expectations. Of course expectations ni contohnya daripada carer lah biasanya. Okay, expectations daripada carer ni kita kena explain betul-betul dengan carer apa yang stroke patients tu alami, and macam mana kita as a carer nak kena bagi social support kepada patient tu sendiri.
The most challenging part working with the stroke patients is the participation from the patient. Sebagai contoh, sekiranya pesakit kurang bermotivasi ataupun mengalami masalah emosi yang ketara, jadi masalah ini boleh memberi impact dalam proses pemulihan. Selain daripada itu, cabaran utama dalam bekerja bersama pesakit stroke juga adalah family support itu sendiri. Perkara ini sangat penting kerana sekiranya pesakit itu bermotivasi tetapi tidak mendapat sokongan daripada keluarga, ia juga akan merencatkan atau juga melambatkan proses recovery pesakit itu sendiri.